Unfortunately, heart disease is still the #1 cause of death in the United States. Everybody is so, I would say, almost hyper-focused on cholesterol. But what I've been doing now in my office here is diving deeper into why does someone get cardiovascular disease in the first place. And it's not enough just to say you have high cholesterol, you need to be on a statin drug. In my opinion, that's an incomplete picture, and that doesn't give us enough information. We're able now to look at what's called LDL cholesterol, which is the bad cholesterol people hear about. But there's different what's called particle size. The size of the molecules are very, very important. We're able to do a deeper dive into looking at those, as well as the HDL, the good cholesterol we hear about. The HDL is very healthy for us when it's large. The LDL is less troublesome if it also is large. So we want to have large particle size, is what I'm basically telling you. And the other area is inflammatory markers. So I've been doing a whole screen now looking at inflammation of the blood vessel walls. And if a person doesn't have much inflammation at all, and even if they have high cholesterol, that person probably will not develop cardiovascular disease. You have to have a combination of both excessive inflammation and excessive poor lipid profile in order to exacerbate the problem. And that's not the whole problem at all, of course. I mean, you could have high blood sugar and be a cigarette smoker and lack of exercise and drink too much alcohol and various excessive stress. All these are risk factors for cardiovascular disease. But what my message is today, and I want to stress the importance of, if you're going to have your doctor check your lipids, you need to have a complete overall screen to take a deeper dive, looking at the different kind of particle size and particle concentration, looking at the inflammatory pathways, and also do a deeper dive into, are you insulin resistant, or you're developing pre-diabetes, just looking once again at fasting glucose, and even only the hemoglobin A1C is not quite enough for that one either. There's other things we look at as well. We look at insulin secretion, we look at what's called C-peptide, something called fructosamine. So it's very important that we do a very thorough analysis if we truly want to prevent cardiovascular disease. Not only the biochemical analysis, but discuss with your patients what you're eating, how you're living, are you sleeping effectively, are you under excessive stress, are you smoking, are you drinking too much alcohol. All these play a vitally important role in the development of cardiovascular disease. And the last part I want to say about that for now, there's much more in the future, is how much sugar do you eat? Sugar will exacerbate cardiovascular disease. It will exacerbate inflammation. It'll contribute to obesity, high blood pressure, diabetes, increased risk of stroke, increased risk of heart attack. All these things can be exacerbated if someone's eating large quantities of sugar in their diet, which most Americans are, unfortunately. So we have to take a holistic and a comprehensive and a complete approach if we truly want to best help our patients and have them truly prevent heart disease, much more than just doing a very limited lipid profile. So thanks for listening. I hope this was helpful for you today.